the question, and I brought this up last Monday, Meridian, okay? I emphatically said we have not purchased any nursing home in Meridian. I want everybody to be clear.
Since I'm the person that wrote the letter to the editor, I just wanted to say when you get done, I'll tell you why the confusion is from the Bosque paper, because I printed out what the Rose Beck said. And
the editor of the Bosque County News has not been reporting things accurately. Okay. The purchaser of the nursing home in Meridian is Glen Healthcare Partnership, Inc. That is, at this time, my understanding, is owned and operated under Rose Beck and a Mr. Moore are the two parties to that, as I understand it today. They are the ones that put the bid into the nursing home board in Meridian. I think in the frequently asked questions, there's no, General Medical Center is not involved in the purchase of that nursing home. No employees or affiliated physicians of Glen Rose Medical Center are part of the purchase of Meridian Nursing Home. Where is Glen Rose Medical Center involved? There is a clinic inside that building. We have an interest in leasing a clinic so that we can put a physician's clinic in that community. Right now, the proposal is for $1 a month, we can lease that space. The agreement has not been signed. There's no, all I have is a draft at this point in time, but we've got to generate more revenue, we've got to generate more income to lower these losses. And that is an open opportunity for our community that needs the service, and certainly something that would enhance our position from a revenue standpoint. That was, I think, rumor number one.
Well, let me finish saying what it was that I was concerned about. When I was at the last town hall meeting, one of the board members who's sitting over there, I asked specifically whether there was any hospital district money that would go for support outside of the boundaries of the county to for any type of support, any money that would go at all to Meridian Clinic or to Pecan Plantation. Now, that gentleman said, yes, there would be taxpayer money that would go for that. He may have been mistaken, and you may tell me, in fact, that not one dime of hospital district money would go for that clinic, and that would be fine. But that was where my confusion was, is that the board member said that there would be at least not paying for it. I don't know who Rose Beck is, and I couldn't find her business on the internet. That's another situation. They have their own problem. I'm talking about the idea of whether or not taxpayers within this county would have any part, however small, of helping to, support or whatever the other clinics. And I see that as a yes or no answer.
The law allows a hospital district to go outside its county lines to provide health care services. That changed about 3 or 4 years ago. I believe it was down in Llano County that they had a similar problem, and they were looking at going outside their county lines to service a community. And I believe that was that's kind of when that changed. Whether we spend money outside the county lines, you could look at it. It's not a simple yes or no. Here's the way we look at it. If we put in a physician's clinic and we're spending $50,000 a year to staff that, and we're pulling in $100,000 a year so that we net out $50,000 to reduce our losses, that reduces taxpayers' liability. And in essence, you're not funding spending money. In a way, you may be considered spending money, but you're getting more money back into the county to reduce losses. And that's the concept that we're working with. And it is a community of services, and it can fall under the guidelines of hospital districts.
Well,
however, this would be something that, this is management today. Okay? Once a hospital district board is formed, they will have the ultimate responsibilities of whether that can be done or not be done. Management here is trying to figure out a way to reduce losses. And the quickest way is to find additional business that generates more money than expenses and always reduces losses.